Although each project is different, over the years we have learned planning principles and methodologies for off-campus projects that have proven to be successful. Here are 5 key points. Agree on the objectives. Of course, saying this is obvious, but what happens if there isn't clarity about the relationship between the strategic goals and the financial goals? The strategic objective may include creating a superior ambulatory care delivery system that will gain submarket share and control a given population. On the other hand, the financial objective may include achieving a targeted profit on each service line as well as the entire facility. Let's say that a strategically important service line, such as ambulatory surgery, doesn't show to be producing a return on investment in the initial years, but that it's necessary in order to accomplish the strategic objective. Then what? This is a typical dilemma for a project that's off campus, but it may not be understood until late in the planning process. If the objectives weren't agreed to early on in the process, then the project may be delayed while the planning team wrestles with these issues. Complete an ambulatory network plan first. Most systems will want to plan for coverage of the entire service area, and that will require more than one off-campus facility. To ensure optimal coverage and to avoid cannibalization, we recommend defining the entire service area and breaking it into convenience-based submarkets. Here's an example of a war room map, if you will, where we divided up the submarkets based on a retail trade area methodology and analyzed each submarket to determine optimal location, service mix, physician complement, and capital costs for each facility and for the entire network. This approach helps you locate and plan facility number 1, knowing where you would want to locate facility number 2 or 3. Base the program on realistic physician recruitment. The business plan will be based on volume projections, which will be based on the physician complement. If you aren't sure you can produce the requisite physicians on day 1, the performer will suffer greater startup losses. We would suggest making sure that the physicians that you base the visit and volume projections on are going to be present at opening, and if you're not sure, consider phasing the project around realistic physician enlistment objectives, or downsize the program and use a smaller facility as a supporting spoke to a hub facility where you can assemble the critical mass of physicians. Plan using lean principles and innovations. Lean planning efficiencies and savings are now necessary to produce the volumes in the least amount of space with the right amount of staff. Concepts such as patient tracking systems, self-rooming, kiosk check-in, new ways to employ IT while treating patients are being used by the leading systems throughout the country and should be investigated for any new or renovated facility. Work with an experienced team. Off-campus facilities require different skill sets and techniques than other facilities, such as on-campus medical office buildings. Prior experience in planning and programming this type of facility, in recruiting physicians, in arranging the capital for off-campus projects will prove invaluable. Insist on experience with similar projects from your consultants, architects, and developer. So to recap, number 1, agree on the objectives up front. Number 2, complete an ambulatory network plan first. 3, base the program on realistic physician recruitment. 4, plan using lean principles and innovation. And 5, work with an experienced team. Over 25 years of planning off-campus projects, we've learned many lessons, and these are only a few. We see the planning and implementation of these projects as a critical step in the re-engineering of our healthcare delivery system, and we appreciate being a part of improving patient care.